Welcome to the Maine Academy of Nutrition and Dietetics COVID Conversations video series. In this series, we will speak with dietitians around the state of Maine who practice in a variety of settings, focusing the conversation on how the COVID-19 pandemic has both positively and negatively impacted their work. Thank you everyone for checking out this next video. I would like to thank my two guests, two dietitians from the academic side of dietetics, and I will let them introduce themselves. But again, this is the Maine Academy of Nutrition and Dietetics COVID Conversations. So we'll be discussing COVID as it relates to our students in dietetics and how that field and just overall aspect of education has changed for them. So Mona, would you like to go first and introduce yourself and tell us a little bit about your background as a dietitian?
Well, hello everyone. My name is Mona Tarian and I'm a registered dietitian. I have been a registered dietitian in the state of Maine since 1996. And I am originally from Canada. I hold a master's degree, which I completed here in the state of Maine and in business, and also hold a doctorate from Rutgers University. I have worked in clinical settings, management settings, and academic settings in my career as a registered dietitian.
What about you, Eileen? Tell us a little bit about yourself.
So I'm Eileen Malloy, and I'm a registered dietitian nutritionist. I also like to say I'm licensed in the state of Maine, and I'm also a certified diabetes educator. So I've been working at the University of Maine as an instructor and as the undergraduate program coordinator for about 3 years now. And prior to that, I worked primarily as a nutrition counselor and educator for an outpatient healthcare system. So I love teaching the students because it allows me to bring what I learned in the past now for this next generation.
And so can each of you tell us a little bit about how COVID has impacted what you used to do with your students versus what you kind of had to shift to? And Eileen, do you want to go first, since we'll start with the younger ones first?
Yes, and I'm going to clarify, because traditionally you would think of younger students coming to do their undergraduate, so that might be the 18 to 24-year-old range. But what we're finding nowadays is that many people are coming back for a second career. So one of the things that I noticed has changed is, and maybe it's morphed, is that you still have fresh off high school coming into the university, but you also have students transferring from other colleges, starting, as I said, second careers, and all of them are looking for a place in the field of human nutrition and dietetics. So yes, I would help them get oriented to the program, help them figure out the classes to take. But I'm also teaching a variety of classes, anything from the freshman orientation class to the science of food preparation to counseling and diet therapy. Oh, and food service management. So a little bit of everything. So each of them are slightly different in how COVID has adapted it. What definitely is the same between all of them is that as an instructor, I had to rethink how to teach, because I can teach via Zoom, but to me, it required giving them extra materials of pre-recorded lessons, of how to read things ahead of time to make the time via Zoom more valuable. At the same time, some students clearly needed and wanted an in-person experience. So the same class I would do both in person for some and in person, face to face, and via Zoom for another cohort. So it kind of, and this is not unusual for instructors to have to reinvent how they're going to teach to make it effective and inclusive.
Yeah, I think that inclusivity, because we, as instructors, we know that students learn every student learns differently, right? And so you can't just assume by going on Zoom and teaching the same material that they're going to be able to grasp it the same way. So,
Well,
right?
the other thing that I would add, just to give some examples, is in the science of food preparation, there are students who can no longer come into the commercial kitchen or teaching facility to practice and learn about foods in a hands-on method, but they still can have the lab by me reinventing the lab for them to do at home, but in a way that's inclusive of what they can afford, their own personal choices. So it's how can you teach the lesson about vegetables or about starches, but in a way that is going to help all of them. And the final thing example I would give is related to counseling and diet therapy, because in that class, we traditionally would think of sitting across the table from a client or a patient. But since we're doing so much electronically now, they now learned how to do a Zoom counseling session. So, right, that we'll talk about how do you do it face to face, but how do you do it via Zoom?
I think that's a positive thing that's come out of this, right? Like
Yeah.
as a private practice practitioner, that was not telehealth was not something that was taught to me. Granted, I went to school a little while ago, a lot of while ago. So it wasn't really very few people in medicine were actually using telehealth. But now being forced into it with the pandemic
Is a good thing.
is a good thing.
It's a good thing. So I think it's been challenging for instructors. It's been very challenging for students to learn new methods of doing things. But on the other hand, we've been able to say, oh, we could do it like this, right? And that to me is a cornerstone of what dietitians do, is they learn to think on their feet, to adapt to circumstances. That's part of our training. And Mona, I hope I didn't take the words off of your, out of your mouth. But I see that as what we are training our students to do, as well as what we are trained to do. Let's adapt. Let's get the job done.
Yeah, I feel like that's very much a mantra of dietitians.
Yeah.
Okay, Mona, so tell me a little bit more about what's happening at the graduate level.
So I think I want to take off right where Eileen was talking about this tremendous capacity that we have to adapt to new situations. And in my case, I am the director of the Dietetic Internship. So students, once they go through Eileen's program and graduate with their undergraduate in nutrition, then they have to complete a practicum or a dietetic internship, which is about 7 months of time. And at the University of Maine, we offer that combined with a master's degree. So it's really a 2-year process that we have these students until they really go out into those fields of practice and complete their practicum or their internship. And so with our students being in the field when the pandemic really became a huge issue for our hospital sites all around the state, they were really forced to adapt to these situations and things that they never expected to be doing, getting their temperature taken every day, wearing masks and face shields, not really being able to see patients in person, but having to call patients in their room over the phone, having to stay in their offices. So it was a completely different experience for them than anything we had ever told them it was going to be like. And so they really rose to the occasion and adapted very well. And I feel like the interns that have completed their rotations amidst the COVID pandemic have come out with a whole set of skills, like Eileen was saying, about being able to have conversations with patients over the phone, over Zoom platform, which are things that they would never have done in the past. And so they've learned to really adapt, which has been sort of a positive result, I guess, of COVID-19 on the not negative side necessarily, but what's been more of a challenge, I think, for me as someone trying to get students into these sites all around the state has been the fluctuation, surges in cases, and then the hospitals responding, or the community site responding in a way that would actually prevent the students from getting into some of those sites at times, or really challenge them in terms of the amount of time they were able to spend in sites. And so it's really made it challenging for me as a director to be able to give the students what they need in order to become registered dietitians. I've really had to work much harder at trying to provide sites for them to complete their internships. And I think that's been sort of a challenge
Yeah,
of this environment.
I can imagine that. Thinking of just my internship, I did my internship at Maine Med, and I remember doing extra rotations in the critical care unit. Well, currently our critical care units are COVID units, right? And so as your role as an academic advisor, like your job is also, I'm going to assume, is to protect those students, right? And so how, this balance of protecting the students, but also getting them exposed to all of these different learning things that I had access to because I went through not in a pandemic.
Correct. And I think there was definitely some fear, concerns from the interns about going into hospital sites and community sites, because and so there should have been, because they wanted to make sure that they were safe. And fortunately, I think the university was very good about instituting policies and procedures and really helping those of us that have students placed in different sites around the state to come up with safe ways that we could do this: protection for the student, protection for the site, and protection for the university, to make sure that everybody was safe and had as worthwhile and pleasant an experience as could be, considering what we were all faced with and the chaos that ensued, and all of the unknowns. I think it went very well, surprisingly very well, and people were able to get the experiences that they needed. And I think we were able to meet student needs, which was wonderful.
Would you say that too, Eileen, is that the university did a good job and that you felt, or your students felt safe even coming to campus?
Yeah, I would say what I was impressed with and was the same thing that made it challenging, which was that everyone was given a choice as to how they would best be served. So students were not required to come to the university. Those who did not feel comfortable doing that could choose a remote method of learning, as I indicated earlier. But then students who chose to come face to face, we are set up for protection around here. 6 feet apart. You have the mask, the cleaning that happens. So even in the commercial kitchen, which I teach in, normally there would be 16 students. Well, now there could only be 6 because of social distancing. So how can you adapt to help the students do their learning, but at the same time as be safe?
That's a great example. I think, the fact that we can mitigate all of these points in our day-to-day life to, keep our jobs running the way they're supposed to run. But it does create a lot more work on the professor, right? Like,
oh yeah.
literally twice as much, if not 3 times as much.
Well, yes, because you're really having to think through, how will this work when I present it this way? And that's not just the education piece, but it's also, well, let's say in education, we are always trying to have active learning. So by taking away the face-to-face and by socially distancing us, it makes it more challenging to say, let's have a breakout group, right? Let's, let's work on this little project together. And so you would reinvent, though, how can I still have active learning going on at the same time as we're distant, either through the computer or even in a classroom, we're physically distant. But it can be done. I think, I look forward to going back to a time when we can be together again physically for the most part. But, it can be done. Yeah.
I think that's the biggest takeaway of this,
Yeah.
is that it can be done, and we did it, and we did it well.
Yeah.
Mona, I know your job in the past has been very taxing in terms of all the sites. I mean, Maine is a really big, big state. So can you speak to a little bit more about how maybe our push in the pandemic has made us utilize technology in different ways?
Yes. So I think that's been, again, just a really positive situation that's occurred because of the pandemic. In the past, I would have to do a tremendous amount of traveling. When you think of all the different hospitals and community sites in the state, there was basically numerous days a month that I would spend on the road traveling from site to site, which makes for very non-productive time. And with now everybody being super comfortable using Zoom platforms and having these virtual conversations, we've been able to really reduce the travel. So, less resources going to that travel budget, and more is being kept to do more things for the interns, for example. And then the time savings has made me just a much more productive practitioner in terms of being able to do more things. And I think the meetings that we have virtually sometimes are actually better than the ones we used to have in person, because I think about how we used to meet, for example, in the cafeteria and have these conversations with students and preceptors in the cafeteria. Now we're holding those conversations in our own homes, but they're more, to me, they're more private, and they're definitely more of an environment conducive to some learning and some feedback, and an ability for the student to grow and become a practitioner. So that's been a real positive turn of events for us with this.
I love that. I love that we can, and maybe that's just the dietitian in me, that we can find the positive in such, we hear so much negativity about the pandemic between the economy and the number of lives lost and things like that. But I think it's really important that we can find these little glimpses of positivity that's happened.
Yeah, and I just wanted to add to what Mona said about tapping into resources in the pandemic to enhance teaching. So I'm teaching a new class this semester called Career Exploration in Human Nutrition and Dietetics. And the intent is to introduce students to all the different things you can do with this major. What are careers that can happen from the major? And I've got between 8 to 10 speakers coming in via Zoom. So I've had 5 already, but I'm not sure I would have thought about that prior to the pandemic, about tapping my colleagues and saying, could you just pop in for 15 minutes? And it is a wonderful experience for the students to hear from a wide variety of people in the nutrition field, so they can begin to visualize, what might resonate with me. So I've really enjoyed using technology to bring speakers in, and that's just one example.
That's a great example. I mean, I kind of feel the same way about, my role in private practice. Like, I've been able to reach out to other medical providers by just jumping on a quick 15, like you said, 15 minutes. You can get a lot done in 15 minutes when you save that travel time of getting there. Like, for me from Kennebunk to come see you guys in Orono, that would be a day. So it's just, I don't think we talk enough about the amount of time saved and how that translates to being more efficient in our jobs.
And I think going forward, what we can do is now take with us to the next phase when COVID is behind us and say, what efficiencies can we use? What do we really need to bring back so that we can do an even better job? Because that's what we're always working towards.
Yeah, that was going to be my next question is like, okay, so we've been shoved into this experience. Like, what are we going to take from it? And how can we kind of keep what we like and get back to what we used to like?
Mm.
Mona, is there
I think that's a great point. I think one of the things that we have lost a little bit as dietitians through this process is not necessarily that one-to-one communication with the patient, but we were getting really involved in doing the physical examination of the patient. Nutrition, we call that nutrition focused physical exam. And that has been something that I've been very passionate about as a practitioner for years and years. And we have just gotten to the point where we feel comfortable as dietitians performing these tasks. And then COVID hit and we were unable to do that for the last year. And that is one situation where I look forward to being able to actually do hands-on examination of a patient, which we have not been able to do or teach our interns and our students how to do that. But I think it's now going to be this combination of, yes, let's do it, and let's do it for real and in person, but let's also use the technologies that we've acquired in this past year to disseminate this information over a much wider network. Yeah. So I think doing this blending of virtual and in-person education will really expand who we're able to provide this information to. Because when you think about the state of Maine, and I think about the registered dietitians that are in the state, they're so spread out that it's very difficult for us to get, this type of education to all of these, practitioners that are in little nooks and crannies of the state. And I think having this opportunity to now provide this information and have, maybe I have this subject that I'm doing this exam to in person, but yet I'm now broadcasting it to other people who are not able to join me. So I think it's the best of both worlds. And I think, like Eileen was saying, we're going to take this and put this all together. And I think our education to future practitioners in nutrition will be much improved by what we do over the next couple of years for sure. So
that's awesome. Is there anything else either of you would like to add and tell our viewers about your experience? I mean, I love the positivity, but don't feel like you need to stay positive. If there was something that you struggled with, or not. I mean, I think we covered quite a bit.
Yeah, I guess the only thing I would add is I think we believe it's important to be positive and to go forward and to accomplish things. But we, as dietitians, are also people. We understand human connections. That's part of our training too. So to me, it's important to always acknowledge it comes at a cost. So the cost is, as a professional, the amount of effort and angst to try and do a good job and keep everyone safe. And I also recognize for the students, the cost to them that's emotional and physical. So acknowledging that there is a cost is important at the same time as we can say, all right, what are we going to do?
That's a really good point.
I agree with Eileen's point, and I'll even take it a step further just in terms of our organization and some of our colleagues in and around the state and even in and around the country, this is now the second year where we've gone without a national conference. And so all those opportunities, and we've also gone without an in-person state conference for now 2 years. And so I think those opportunities to have those warm relationships and that networking there is a cost to that. Because we're more efficient, but yet at the same time, I really miss the opportunity to network with my colleagues, and that's how new ideas are generated, and those small conversations, let's not take those for granted. And I think that's the piece that's missing in that virtual environment, is that we get right down to business and we're very efficient and we have meetings and we talk about what we want to talk about. But I think some of that, some of those conversations that happen in between meetings are sort of lost in this environment. And I for one, think that I'm looking forward to going back to being in person for some of those kinds of things. And I think that's definitely been a huge cost that we've had to deal with in terms of networking and acquiring those communication skills.
Yeah, I completely agree with that. I mean, just the realization that even last year, our licensure had to be like, part of our licensure is to have in-person educational opportunities, and we weren't able to do that. And so having to even mitigate that was a big deal. And, I have 2 other dietitians that work with me, and like making sure that they, are aware that this was mitigated. And, but yeah, the socialization is a really big deal. And I can only imagine, like, if we as professionals are struggling, to make those connections, that our students are also struggling, especially those first years, or even the non-traditional students.
There isn't the casual conversation where you pick up things that you didn't know you were missing. Because, right, you don't have like a little bitty interaction about, what did you think about that project? Or, what did you do for this, right? That's not happening in that kind of casual way. Yeah.
Wow.
Yeah.
Lots more to talk about.
Yeah.
So anything else that you guys want to add real quick? We talked about a lot, and I think it's really important, just with these videos, we've really been exploring the different fields of dietetics and how COVID has impacted those, and it's very different. I think we all ended up coming around to something positive, because again, that's our profession. But thank you both for joining me on this video and for all your thoughts on this topic. And for our viewers, stay tuned. We have more videos coming. Thank you for watching this video. For more information on the Maine Academy of Nutrition and Dietetics, please visit our website or check us out on social media. For more information regarding the Maine Academy's public policy efforts, please feel free to reach out to our volunteers listed on the slide.